Obstructive sleep apnea is a common sleep disorder that causes frequent pauses in breathing during sleep. Most people with sleep apnea experience symptoms such as loud snoring and daytime sleepiness. In obstructive sleep apnea, a narrowing of the airway during sleep leads to breathing disruptions. These breathing interruptions reduce the quality of sleep and, if left untreated, can lead to potentially serious health consequences. People with sleep apnea repeatedly have reductions or pauses in breathing for brief periods while they sleep, although these lapses cause a person to awaken periodically and reduce sleep quality. Sleepers may not fully wake up and remain unaware that their nighttime breathing is abnormal. Obstructive sleep apnea is the most common type of sleep apnea. It is estimated to affect 10% to 30% of adults, but in many cases goes undiagnosed. Symptoms of obstructive sleep apnea are excessive daytime sleepiness, loud snoring that is often punctuated by gasping or choking sounds, headaches in the morning that may persist for several hours after waking up, restless sleep with periods of wakefulness during the night, increased need to get up from bed to urinate, irritability or frustration. Many of the symptoms of obstructive sleep apnea can also be caused by other health issues, so the condition cannot be diagnosed by symptoms alone. In people with obstructive sleep apnea, the muscles in the back of the throat relax during sleep, reducing space for air to pass through. Snoring occurs as the airway narrows, and when the airway is obstructed, a person fails to get enough oxygen. The lack of oxygen causes partial or complete awakenings in order to restore airflow. The primary risk factors for obstructive sleep apnea are related to age, male, body weight, and certain anatomical features of the head and neck area. Studies have identified associations between various other factors like cigarette smoking, hormone abnormalities, sleeping position, using alcohol. Sleep apnea must be diagnosed by a doctor or sleep specialist with sleep study. Treatments for obstructive sleep apnea are: a common type of treatment is uses a continuous positive airway pressure device that sends a stream of air that is always set to the same pressure level. In addition, obstructive sleep apnea involves lifestyle changes to help manage symptoms. They are reducing BMI by losing weight, getting regular exercise, which may decrease obstructive sleep apnea symptoms even without weight loss, altering sleeping position to avoid back sleeping, reducing alcohol consumption. Accordingly, obstructive sleep apnea has been associated with a higher risk of a diverse range of health problems. Therefore, you should act immediately if you need healthy life. Please thumb up with a like and follow us for more medical knowledge. Thank you for watching us.